Okay, so I'm Neil Conlon. I'm from Dublin City University, and tonight I'm going to tell you about some of the work I've done over the past 4 years, my PhD. I'm funded by the Irish Cancer Society under the Breast Predict programme, and therefore my research is focused on breast cancer. Over the past 20 years, the treatment of breast cancer has been revolutionised. Unfortunately, though, some patients don't respond to current treatments, or after initially responding, they relapse. So my research is trying to find new treatments for those patients. Breast cancer is the most common invasive cancer in women in Ireland, with 1 in 10 women diagnosed with breast cancer before her 75th birthday. However, breast cancer is more than just one disease. There are 3 different subtypes of breast cancer. The breast cancer that relies on hormones like estrogen, breast cancer that relies on HER2, or triple-negative breast cancer that doesn't rely on either of these. But my work is centered on HER2-positive breast cancer. This type of breast cancer accounts for approximately 15% of breast cancers in Ireland. What this means is that roughly 450 women each year is diagnosed with HER2-positive breast cancer in Ireland. This type of breast cancer is generally more aggressive, and historically it has had a poor prognosis for patients. So HER2 is a molecule that sits on the outside of the cancer cell, and it causes the cancer cell to grow and survive. That's why HER2-targeted therapies were developed, such as Herceptin and Tyverb. These drugs that are used in the clinic stop HER2 from working and kill the cell. Unfortunately, though, cancer cells can sometimes find ways around this and restart the growth, causing drug resistance against HER2-targeted therapies. What this means for a patient treated with HER2-targeted therapies is that hopefully they'll have a complete response to the HER2-targeted therapy. They can have a partial response, which means they have some cancer still remaining. Or unfortunately, they can also have no response. So these are the patients that we're trying to come up with a treatment for. So to do this, we try to recreate HER2-targeted therapy resistance in the lab. And in order to do this, we grow different types of HER2-positive breast cancers in dishes in the lab and treat them with HER2-targeted therapies. And generally, this kills most of the HER2-positive breast cancer cells, but some still survive and continue to grow. So what I've done is then I've analysed these cells to see how they're different. I've looked to see, do they respond to any other anti-cancer treatments? I've looked at the physical characteristics of these resistant cells, and I've examined them down to the DNA level. And because of this, we've now come up with 2 potential causes of drug resistance in this form of breast cancer. And thankfully, there are 2 drugs that may be able to treat this type of resistant breast cancer: LB100 and Sprycel. LB100 is an anti-cancer drug that's actually currently in clinical trials. And Sprycel is a anti-cancer drug that is actually used in the clinic currently to treat leukemia and lymphoma. And we found that if you combine either of these drugs with current HER2-targeted therapies, it eliminates the cancer cells. And just to quickly show something like that, you can see these are resistant cells, and the higher the bar, the more cancer cells there are. So the HER2-targeted therapies and Sprycel have little effect on these resistant cells, but when you combine the 2 together, it stops the growth. But we want to see, can we combine these drugs from the start and prevent resistance from occurring in the first place? So this slide shows cancer cells grown on dishes. They're treated with either HER2-targeted therapies, Sprycel, or the combination of the drugs. And the more blue there is, the more cancer cells there are. So you can see no treatment, there's a lot of blue. HER2-targeted therapies are doing their job and eliminating most of the cancer cells, and the combination is similar. So I treated this for 2 weeks, but I continued this on for a further 8 weeks, and you can see that the blue is increased in the HER2-targeted therapies. They've become resistant to the drug, but this didn't occur in the combination treatment. So in summary, we've recreated drug resistance in HER2-positive breast cancer in the lab. We've identified 2 potential treatments for patients, which are currently finishing preclinical testing. And these drug combinations may eventually help patients who no longer respond to current treatments or didn't have an initial response to begin with. I'd like to thank the Irish Cancer Society for letting me speak tonight and funding my PhD under Breast Predict, the NICV in DCU, my supervisors and the research group, my family, and of course all the supporters of the Irish Cancer Society for all your fundraising. Thank you.